Hello, and welcome to the first episode of a new show here on Rogers Television that we're calling Keeping London Healthy with Dr. Mario. My name is Dr. Mario Elia. I'm a local family physician here in London, and I'm very excited to be working with Rogers on this new format, which will give us an opportunity to explore all topics related to medicine and health. Obviously, over the past year, there's been a lot of attention given to medicine and health during the pandemic, and it's safe to say it's dominated nearly every aspect of our lives. What we're hoping to do with this show is tackle some of the issues that are of interest to you guys, the public, and to sort out good information from misinformation, dispel some myths, and really give you the best advice for you and your families. Our initial plan is for monthly shows, with each show really having a specific focus that we'll be focusing mostly on and doing kind of a deep dive on that topic. The first few episodes, of course, will be focusing on COVID, since that's obviously top of mind for really all of us right now. But my hope is that as we get into the summer months, we'll be able to do some other topics like diabetes, COPD, osteoporosis, cancer, nutrition, exercise. My hope is that we get a chance to kind of explore a lot of these concepts in detail. But of course, the first few episodes, we're going to focus on COVID primarily. So for many of the shows, we'll have an expert come on to start the show to ask some commonly asked questions to answer some commonly asked questions about the topic. But a good chunk of the show will include answering some viewer questions and debunking some common myths that I've come across. We'll be active on social media, letting everyone know how to submit your questions once we announce the topic for each episode. So we really want to engage with the public. We're really excited to have relationships with everyone out there and to really do deep dives on these topics. So without any further ado, we're going to get to today's episode right after the break. And truthfully, there was really no debate as to what our first episode was going to be about. It's really the most important medicine and topic in medicine right now. So we're going to talk about the COVID vaccine today. Welcome back. So again, today we're going to be talking all about the COVID vaccine and giving you guys some hopefully useful information to be able to make the best decisions for yourself and your family around the vaccine. So what do you need to know about the vaccine? Again, many of you have been following this story over the past year, kind of following everywhere from the very beginning through the studies and through announcements in the media. So we'll kind of do a really quick review. So let's start on how we got here. So the genome, the COVID genome, meaning like the genetic code of the SARS-CoV-2 virus, which is what causes COVID-19, was first sequenced in January 2020. So that was the code. So once we knew the code, researchers all around the world started working on the process to get a vaccine ready. So you have different approaches, different companies involved, different countries, each moving kind of systematically through the process of first developing. A lot of the technology was already developed, but then they had to use specifically the SARS-CoV-2 virus with these mechanisms. So they moved through human trials, and then we got to where we are today. And we're amazingly at the point, just over a year later from when we first actually coded the genome, with now multiple vaccines that have been proven in large trials to reduce the number of cases of COVID, and more importantly, to reduce the number of hospitalizations and deaths associated with COVID-19. Because that's what ultimately is important, right? The reason why we've taken this so seriously for so long and really society has been flipped on its head is because of the hospitalizations and deaths that we've seen worldwide from this virus and why we've taken this so seriously. So the fact we're at the point now, February 2021, with 5 candidate vaccines, more on the horizon, is really exciting and really super cool. So we're going to kind of go through each vaccine. We're going to talk about kind of where we are in Canada right now, and we've got a lot of questions in from viewers already. So we'll get to them right now. So first question: how effective are these vaccines? Okay, so just to review, right now in Canada, there are 2 vaccines that are currently approved and being administered in Canada. I'm going to refer to them by the company that's developed them. I don't necessarily like to refer to drugs by their brand name or by their company name, but that's how everyone is kind of referring to them now. So I'm going to default to that. So right now in Canada, the two vaccines that are used and that are approved are the Pfizer vaccine and the Moderna vaccine. So those are both mRNA vaccines. And both of them were studied in huge trials. So Pfizer had 43,000 people in their study. Moderna had 30,000 people in their study. And what they did is they took two groups. So people were randomized either getting the vaccine or getting a placebo. So they thought they were getting a shot, but they just got basically a placebo. So it was kind of an inert substance. And they looked at what was the difference in those two groups about how many people actually developed COVID. And what they found was those who got the vaccine, so the numbers for both were pretty similar for both the Pfizer and the Moderna. So it looked like the people who got the vaccine had a 95% lower chance of getting COVID than those who didn't get the vaccine, which is pretty amazing. Like 95% for a vaccine is pretty awesome. A bit of comparison, the flu shot that we give every year is somewhere between 30 and 70% effective. So still good, and that's the reason we give the flu shot every year, but it's nowhere near 95%. So those two mRNA vaccines are super incredible, super impressive at reducing the risk of getting COVID. And not only the risk of just getting COVID, but the risk of getting severe COVID requiring hospitalization and leading to death. And we saw impressive numbers with there as well. Okay, so in terms of their effectiveness, there's no doubt that both the Pfizer and the Moderna vaccine are both quite effective. What about the other vaccines? So there's 3 other vaccines that have studies done, and Health Canada is kind of looking this over, and we should get approvals on all 3 of these hopefully in the next couple of months. So that's the AstraZeneca vaccine, also known as the Oxford vaccine, the Novavax vaccine, and the Johnson & Johnson. So all 3 of these, again, are effective vaccines. The Johnson & Johnson, you've probably heard the most about recently, is about 85% effective against severe disease. So when you think 85%, what does that mean? Well, if one person, if a group of people, we can knock it down by 85%, we're making it even less likely for them to pass it along to people as well, right? Because we've protected them. So things like 85% effectiveness, even though it's not 100%, can quickly affect the amount that we're seeing in our community and bringing cases even lower and lower. And really, they've seen that in Israel. So Israel is probably our best example right now of a country that's deployed the vaccine widely. So they've given more vaccines in Israel per capita than any other country in the world right now. 90% of Israelis 70 years of age or greater have received both their doses. And what they've seen in Israel early on with how well they've been vaccinating is that they've seen about a 94% reduction in all vaccine, in all cases of COVID. And severe COVID has gone down by about 92%. So that's huge. And that's beyond restrictions, right? Because someone would say, well, is it the vaccine that's working, or is it that they put restrictions in place? The restrictions have been in place this entire time in Israel. So they haven't ramped anything up in terms of restrictions. The effect that they're seeing with the vaccine, after the vaccine, is primarily from that vaccine. So really, really exciting, because people question, well, it's if something works in a clinical trial, does it work in real life? The answer is yes, and Israel is really showing this, bearing that out right now. So we've got the Pfizer, the Moderna, the Johnson & Johnson, which is just one dose, which is really great in terms of not needing to bring people back for that second dose. And the refrigeration requirements are less than it is for the Pfizer and the Moderna as well. Then we've got the Novavax vaccine, which is 89% effective, so that's great as well. And the AstraZeneca, which is about 62% effective. So yeah, 62 is not as great as 95 for the Moderna and the Pfizer, but still 62% is still a really good vaccine. Question that's come up quite a bit is around the variants and how that's going to affect things. And we'll talk about the variants a little later on. So effectiveness looks great. And we're really excited about that. Now, the question is, how safe are the vaccines? And that's the question that we get most often. So a few things about safety. The studies done so far have shown that these vaccines are incredibly safe. The risk of anaphylaxis looks in the Pfizer vaccine to be about 10 per million people. And those are treatable cases of anaphylaxis. To put that in perspective, the allergy risk from you taking penicillin is about 1 in 5,000. And people really don't hesitate a whole lot when it comes to taking penicillin. So again, keep in mind, 1 per 100,000 risk of anaphylaxis with the Pfizer vaccine compared to 1 in 5,000 with penicillin. So really, it's nothing really to worry about. Bell's palsy was something that was mentioned early on with the Pfizer vaccine, but it doesn't look like it's a significant thing to worry about. And the one thing you'll see in the media is stories of people getting the vaccine, and in news reports, within a week or two, someone dying after they got the vaccine. And you have to think about, it's not because of the vaccine that people have died afterwards, because they've studied it in big numbers, and the vaccine doesn't cause death. But you have to think that when you're vaccinating millions of people across the world, some people unrelated to the vaccine and just by coincidence are going to have adverse events after, and some people are going to die after because they had an unrelated heart attack. So don't be swayed by those news stories. A lot of them are pushed by people who are trying to push misinformation and try to scare people. So all in all, it looks really safe, and the data so far has been really, really reassuring. So we'll get to a few more questions after the break. Welcome back. We've got a few more questions to go through, so we're gonna go rapid fire through the last few. So the question we've been getting quite a bit is, have these vaccines been studied enough and thoroughly enough? So a few things to reassure everyone of, that the duration of the actual studies to see the safety and effectiveness are really similar to other studies done on vaccines in the past. The development was faster, but that was partly because of investment and so much money pumped in that they were able to get from the start of the development to actually having the vaccine ready to go. Recruitment was faster because people were motivated to get into these studies. And there was so much COVID going around that they were able to recruit quite easily as well. Short-term side effects were looked at. People are concerned about, what about long-term side effects? And there's really no reason with the stuff that's in these vaccines to be worried about long-term side effects any more than any other vaccine we give, which is already a very, very low risk that we don't really worry about long-term side effects with these. So again, put everyone's mind at ease. I know everyone's kind of a little on edge with how fast this process went, but in general, all of the steps were taken that should have been taken. And again, it reassures me as a clinician, someone who's going to get vaccinated myself, about moving forward. Another question: can I get it can I get a vaccine if I have allergies? This was a kind of a hot button topic early on when the UK was giving their first vaccines. So the only contraindications to getting the COVID vaccine right now is if you've had a confirmed allergic reaction to the COVID vaccine already. So that's one reason not to get it again, and a true allergy, not just kind of some initial side effects. Or if you have an anaphylaxis, a severe allergy to PEG, which is polyethylene glycol, which is in laxatives. Those are the only two absolute contraindications to getting it. If you have environmental allergies, or you have bee sting allergies, or any other allergies, those are not reasons not to get it. They may monitor you for a longer period of time afterwards, but it's not a reason not to get it. So everyone can be reassured by that. Another question: which vaccine should we choose if we get a choice? The answer to that is we probably won't get a choice. When it comes for your time to get the vaccine, I'd be very surprised if you're given a choice right now. We're not being given a choice. And really, between the vaccines, each one will be given for a certain risk category. So when it comes your time, don't hold out for the Pfizer if you're offered an AstraZeneca. Get whatever you're offered, because again, that's going to provide you a fair bit of protection compared to not getting anything at all. What about the variants? We'll talk about that really quickly. So obviously, there's been a lot in the news lately with the UK variant, and the South Africa variant, and the Brazil variant. So what does that mean in terms of vaccines? Well, it looks like the vaccines work quite well against the basic strain that we've had the whole time, and it works very well against the UK variant. All the vaccines do. The South African variant, there's a bit of concern with the AstraZeneca vaccine and how well that may work against the South African variant. And we know that Johnson & Johnson and the Novavax work a little less good, little less well against the South African variant than other variants, but still pretty good. So in general, we'll have to see what happens with these variants. The more we get cases down, the less chance they mutate further, and the better we're going to get a hold of this all together. So really, get vaccinated, get our cases down, and that's really all we can do. But it really shouldn't change the decision to get vaccinated or not, or what strain we get. Everything's going to follow along as it was before. When will I get my vaccine? So this depends on your risk category, and really every week in the news is something different with certain groups getting pushed forward or pushed backwards, or supply chain changing, or us getting a new shipment of Pfizer or Moderna. So really, the thing I'm telling people is follow the news, both traditional media, social media. If you know people who perhaps are kind of disconnected from media, please keep them in the loop. Like if you have seniors in your life, people who have disabilities, make sure that you're kind of watching for news for when they may become eligible. Right now, a lot of people are getting vaccinated because of their employment status, because of where they work. So that's how they're being notified. But once it comes time for instance, 80-year-olds to be vaccinated, you're going to see it pumped out everywhere in the news. But again, keep in mind those in your life who may not be as well connected, and you can be their source of information. Another question is, should your behavior change after you get vaccinated? Because we've heard of, after you get vaccinated, you're still somewhat at risk of getting it, right? It's a 95% reduction, but it's not 100%. So do we still need to wear masks? Do we still need to distance? And the answer is we can probably do a little more than we were before we got vaccinated. And, you're not going to have big parties after you get vaccinated. Like, I think that would be probably pretty reckless. But there does need to be a little bit of a reward for it, right? So is it unreasonable to get together with one friend, maybe unmasked, maybe distanced afterwards after getting the vaccine? I think everyone needs a little pat on the back and some incentive to be vaccinated. So I would hesitate to say don't change your behavior at all, but should we still be avoiding big gatherings? Yes. Should we still mask in settings where you're with people outside outside a reasonable bubble? Yes. We shouldn't just get vaccinated and throw caution to the wind, but a little more interaction, a little bit more risk, I don't think is unreasonable after you get the vaccine. Another question: can the new vaccines cause COVID? No, they can't. The reason is that we're giving with the mRNA vaccines, we're giving the mRNA sequence for our bodies to create a spike protein, which our immune system will react to. That can't cause COVID. There's no virus that's being injected into us, so we can't possibly get COVID. And if you think about it, the reaction that we get from the vaccine and how kind of the aches and the fever and whatnot, sometimes people get within a day or two, will not be nearly as severe as if you would have gotten COVID, because all we're giving is the spike protein. Whereas when you get the actual virus, if you get sick with COVID, you're going to get the whole virus, and you get even a bigger immune response, even more sick. So it doesn't cause COVID, and the adverse events are more mild than if you were actually caught COVID. Do the new vaccines alter your DNA? No, they don't. They can't possibly do that. They don't embed in your DNA. They don't mutate you. You don't turn into an X-Men. Wolverine won't be roaming your hallways. It doesn't embed into your DNA. The mRNA, after it goes into your system and your body makes proteins from it, really gets degraded really quickly. So it's not even in your body for very long. What can we do to help the vaccine effort? So that's a big question, because it's one thing for each of us to get vaccinated, and we each are going to have a really important role to make sure we're vaccinated, that we're doing it to protect ourselves and protect those around us, get the cases down, let's get back to normal life. We all have a role in that. But I would argue that our roles go beyond that, meaning that we each have a social bubble, social media, our cultural groups, our families. We each are influencers in a way. And to just get the vaccine and stay quiet and not try to correct misinformation with others and to not encourage others to get vaccinated, I think would be a huge mistake. Obviously, vaccine confidence is something that we're really pushing, and we really want people to feel confident with vaccination. And some surveys have shown that up to 85% of Canadians do plan to get the vaccine, which is amazing. We want to make sure that gets followed through on, right? So what can we do? You guys are watching shows like this, getting good, getting information, correcting some misinformation potentially. I hope that you take this, and again, you take it to your own groups, right? So if you are part of a group, if you're part of a cultural group or a church group or any a sports team, and the topic of vaccines come up, or the topic of vaccines doesn't come up, and you can bring it up as a topic of conversation, please do that, because you will have more of an influence than you could possibly believe, because we each influence kind of those around us. So it's one thing for me as a doctor to tell you guys want to get vaccinated, and you can take it or leave it. But truthfully, each of you in your own bubbles has way more effect than you can ever think. So please don't be afraid to be loud, proud when you get your vaccine. When you get your vaccine, when you get your jab, put that on social media, announce it to the world. One thing that's come up is, especially with people getting vaccinated ahead of others, and so and so got his vaccine. Which, was he in the right group? So some people have been kind of reluctant to announce that they got vaccinated because they don't want to be seen as having jumped the queue. If you get vaccinated, just announce it. Truthfully, no one's gonna hold it against you. Announce it. Be proud about getting vaccinated. It'll convince others to get vaccinated as well, and really can get us moving along in the right direction. A couple of other questions. Does the vaccine prevent against spread? So this kind of comes back to if you get vaccinated, what kind of precautions do you still need to take? So we're not entirely positive. We're not 100% certain that getting the vaccine also prevents spread to others. But we're pretty confident that that's the case, because we know that when you get vaccinated, even those who do get COVID, even after getting vaccinated, their viral levels aren't nearly as high as those who have not been vaccinated. So they're overall, even if they do get COVID, they get a much milder case. Their viral loads will be a lot lower than those who've not been vaccinated. So it'll be less likely for them to infect others. So do we have 100% certainty that it prevents spread? No, but it's pretty likely, and it's still a pretty strong argument to getting vaccinated. Okay, so again, not 100%, but it's pretty reasonable. The next question: why is the rollout so slow? So this one's complicated. Unfortunately, when you have every country in the world fighting, wanting to protect their own populations, and governments all across the world feeling pressure from their own populations to get vaccinated, you're going to have vaccine nationalism, if you will. So every country wanting to get as many vaccines as possible for their population. And unfortunately, we've had some issues, especially with the Pfizer and the Moderna vaccine, with it not coming in as quickly as we would have liked, and that's caused issues with long-term care homes having a bit of a delay, with healthcare workers not getting as quickly as possible. Now we've got our 80-year-olds who are going to have to wait a bit longer. So it's been extraordinarily frustrating, and I'm feeling that frustration as well. The reassuring piece is that the Pfizer and Moderna rollouts are starting to pick up again. So we should see numbers coming through quicker. We should see more and more supply coming through. It's the end of February. By the time this airs, it'll probably be into March. We're going to see more and more supply come, and you're going to see a quicker and quicker rollout. The other thing that's exciting too is that Johnson & Johnson looks like it's going to work, and Canada's got some orders of that we've secured. Same with Novavax. Same with AstraZeneca. So we're in a much as bad as our rollout has been and supply has been. Can you imagine if we didn't have 5 vaccines that all worked, and if we all had our eggs in, let's say, the Pfizer basket, and the whole world was just fighting for Pfizer vaccine? This would be an even bigger disaster. So we've got five options. Health Canada, once they approve the AstraZeneca, the Novavax, and the Johnson & Johnson, will have more supply. You'll see a lot of that probably go to younger populations. The Pfizer and the Moderna will probably be still more skewed towards older populations, because that's where it's been studied the most, and those are the populations we want to reduce severe disease in. So again, the rollout's been slow. It'll pick up, and optimistic that hopefully by summer we'll be in a much better spot vaccine-wise. So thanks again for all your questions, guys. Thanks to all the viewers for all your great questions. Yeah, get vaccinated when it's your time. When you get that email, when you get that call that it's your time, get vaccinated. Be proud, announce it to the world. And thanks for watching, everybody, and stay healthy, and we'll see you next month.